So I want to welcome everybody to the second of four in a series called Practical Parenting, Understanding Your Toddler. Today is May 1st, which is the kickoff of Speak Up for Kids campaign, which Child Mind has initiated, and it's actually a global campaign. I almost got into an accident 2 days ago driving on the highway and saw one of our billboards. I didn't know we were at that level, but I didn't stop and I didn't get into an accident, so it was a good thing. It was hard for the team to narrow down the most important topics that we'd want to present on, but I think we hit on a really good series. So my topic today is when you say yes and they say no, which could have just as well have been when you say no and they say yes, and we'll talk about all the permutations because they're really, really interesting. So looking forward to talking with you, and we certainly have time enough for questions, so you don't need to wait till the end. My name is Steve Kurtz, and I'm the director of our Center for ADHD and Disruptive Behavior Disorders. They get lumped together. I also have a specialty in certain anxiety disorders, so it's a pleasure to be with you this morning talking about something that I speak with parents about every day and do a lot of training and parent workshops around. So I thought that there are four variations on this theme. There's the ideal, which is you say, please come to the table, and they come to the table. Or you say, put on your tights or your leggings, it doesn't matter, and they say, okay, Mommy, I'll put on my tights. And then they step in, and it's really cute. And I did a home visit yesterday morning, which is the most recent, and that was the example that came up. So that's a beautiful thing, and if that happened consistently, I wouldn't be here, and you wouldn't be here, and we'd be taking a walk in the park or doing something else. And then there's also the fabulous, you say no and they agree. Sweetie, please come away from the hot stove. Okay, Mommy, I don't want to get burned. Please don't drop your brother off the side of the counter. Okay, Daddy, I won't drop my brother. We'll stay safe. So if you said no and they agreed, again, you wouldn't be here and I wouldn't be here. But often enough, we say yes and they say no, like, please come to the table, or please hold my hand so we can go brush your teeth, or any of those variations on things. And when you say no, please don't knock your sister off of the ledge, and then they do. So there are those variations. And I'm sure you have your own examples that brought you here on this lovely morning. There were more graphic versions on Google Images, but I decided not to use the one that had a middle finger sticking up because I didn't want it to live on the internet, because we will be posting this video of this workshop as of tonight or tomorrow morning, I guess. So for starters, what is it about this topic, about this behavior, that brought you here this morning? Give me some ideas, and then I can make sure to weave my comments around some of those concerns or examples. Yeah.
I take my daughter to a class, and she sits on this particular class was a total yoga class, and she sat there and said, Mommy, I don't want to. She's trying to leave the class, and she's no, I don't want to go. And then after that, she lays down, she gets up, she walks around. Do you take her out of the class? How do you manage that?
Okay, so paraphrasing, taking the child to a class, they're not engaging. We don't actually know why for the moment, but how do I respond given that I don't know why and given that I'd like her to participate? Okay, it's a good example of you say yes and they say no. Yep.
What concerns me the most is I see that it happens a lot more at home with parents. And right now, bringing my son to preschool, the teacher said he said the line, he listens, he follows instructions. What concerns me is if it escalates, he starts just playing this school.
So again, paraphrasing, because for the videotape purposes mostly. Kids' behavior is different at home than at school, but the concern is what if this sort of spreads like a toxin and is just starting in the home setting. Okay? Any other examples, things you want to make sure that I weave my remarks around? So restating, having an active child who's already receiving some special services, gets early intervention, and you did a beautiful, what cognitive therapists call a reframe. Rather than saying he's overly spirited or impulsive or hyperactive, you said he's very self-directed. It's a lovely euphemism for what may be what is challenging at times. That's why you're here. So these are the things that we think of when we think about oppositionality, which is not necessarily a pejorative thing, and I don't mean it to be necessarily a clinical term, but it's when you say yes and they say no, or the other variation on the theme. And so the question is, why do we care about it? Some people care about it because they think oppositionality will lead to anger. It's sort of what you were saying about, if I don't deal with it now in a certain way, I'm concerned what it will morph into. And when we think about anger, we think about aggression. So the last thing you wanted when you decided to have children was to have an angry, aggressive kid. And you want to, you're here in part because you want to know what aspects of it are normal and to be expected, and I can go with the flow, and where do I draw the line, or as Obama is unfortunately now having to deal with, where's the red line, based on last night's news. So there's definitely a fear that it'll worsen. Why do we care about oppositionality? If we don't see it as necessary, if we don't see the child saying no when we say yes, or conversely saying yes when we say no, as necessary, then we're going to be concerned about it and reacting to it. So an interesting question is it necessary? And do we see it as adaptive or maladaptive? So when we're in the supermarket and we need to leave and we tell the child to hold our hand and they're grabbing candy because it's positioned where marketers want it to be positioned, or if it's a busy street corner and you're sensing danger that they can't perceive, is any part of their behavior of defying you adaptive? And if it is, how do we keep them safe but also help development? And that certainly will be the focus of what we're talking about. Not to mention how socially awkward it can be, family gatherings, on the street, to have kids actively defying us. I've literally had couples counseling sessions when for example, when a boyfriend who was considering becoming more than a boyfriend was alarmed at the behavior of the children of the person he was dating. So it can be very, very concerning to the point that it actually challenges relationships. So we'll talk more about that. So the question is, how do we go from this to this? I have fun with my graphics, that's my thing. So we'll talk more about that. Part of what we need to consider is, where do you want to end up? We're here at point A. You have a 2-year-old, you have a 2.5-year-old. We're here at point A and we know we want to get to point B, and the question is, how do we get there? And so one of the ways that we think about behavior is whether in the end you have a passive child or an adult, an aggressive child or an adult, or an assertive child or an adult. And clearly, when we think about it, we want kids who are assertive. We don't want them to be passive, and we don't want them to be aggressive. And this is a kind of trichotomy or continuum that people think about. And I would argue that we want to do parenting behaviors today that lead to helping kids be assertive. So I go back in development and think about who we are when we're born. So what capacities do we have when we're born, and how do we get our needs met? So you're a little baby, you don't have language yet, you can't say, please turn the temperature up, please turn the temperature down, my diaper feels a little full. So what do? You cry. If you feel like you're waiting a little bit too long, what do? You said throw a tantrum, you scream. Do something to presumably get more attention. Now, in a healthy environment, in a healthy parent-child environment, or a healthy child-caregiver environment, the caregiver will respond to that, right? If you take worst-case scenarios, what do kids in the worst orphanages do? You wouldn't know because you don't have one and you weren't one, and that's lucky for you. But they learn not to make a fuss, because they learn if they make a fuss, not only won't their needs get met, but it'll actually be a punishing event. So we do want to respond to kids' needs. On the other hand, what happens if we respond too soon to every need? We condition the kind of response where they expect what? Immediate satisfaction. So there is no book you can look up that says, okay, my child is 14 months today, they need to wait 27 seconds before I respond. Let me go to the 20-month version. Oh, today they need to wait. There's no formula you can look up, but we know in doing parenting and caregiving that we want to extend the amount of time kids can go without having to have every need met immediately. So if we all had this thing called delay of gratification, the world would be a much better place. And that will come into play in terms of how we set limits and how we discipline. So that changes over time our capacity to delay and our capacity to experience states that are uncomfortable. So I want to argue now and use it as a point to come back to throughout the discussion, that the goal is not to have kids not be upset. The goal is to have them be upset and not have it be intolerable. Because if we could all do that, then you wouldn't have road rage. I drive on the FDR, and every day, anywhere between 5 and 50 people drive so stupidly that if I was prone to road rage, I'd react. There's just a lot of bad drivers. And we run into those people all throughout the day. So what changes over time is our capacity to tolerate feelings that we don't like. But you're here to figure out and help get some information about what we can do to help make the changes least challenging, because it doesn't have to be overboard the other way. So the goal, again, is to learn self-regulation, not a lack of reaction, which comes back to the fact that saying no when you say yes, or saying yes when you say no, is both necessary and adaptive. So it's perhaps a different mindset for you to welcome it, and to know it's coming, and to know it has to be there. So it's not a measure of good parenting that your kid is never upset. They have to go through the stage of saying no when you say yes, and saying yes when you say no. So the good news is that development is on their side and on your side. The bad news is it just doesn't seem to happen fast enough, right? It's what motivates people to come on a beautiful Wednesday morning to the Child Mind Institute, because it's just not happening fast enough, and it seems painful. And there's that nascent concern: what if I'm handling it wrong, and wanting the best information about that. So some facts about kids saying no. Indeed, it's normal. Indeed, it's desirable. Indeed, it needs to be handled calmly by the adult to the extent humanly possible. If it's handled well, it leads to autonomy, to delay of gratification. So they need experience at it. You just need to go through that to get from point A to self-regulated and assertive. If handled poorly, it leads to dysregulation. It also leads to parents pulling back. Turns out that parents of disruptive kids not only get into more arguments with their kids, they get into less positive time with their kids. So people like me spend a lot of time doing parent training to support daily doses of continued interactions with kids. Turns out that if you wanted the one single best predictor of kids doing well achievement-wise in school, if you were going to change one parenting variable, you would change how much time parents spend talking to kids about non-busy work things, not getting dressed, doing routines, eat your peas, don't throw your peas on the floor, but the more interactive, non-busy work, non-busy time talk. It's the highest predictor of how kids will achieve. It also correlates with their vocabulary. And interestingly, the kids come up to whatever level of talking their caregivers do. So if you're using a lot of words and a lot of vocabulary, kids will come up to that. It's actually hard to surpass your parents, but okay, so if handled poorly, leads to dysregulation, to parent withdrawal, and to fewer positive interactions overall. So just fast forwarding for a moment to what we do when we do parent training, when all this becomes really problematic. The first thing we do before we teach anything about limit setting is just teaching parents how to frequently positively engage with their kids in 5-minute daily doses regardless of how lousy the day is going. And that in and of itself is a very potent intervention. And we do that before we teach limit setting and discipline and all those things, which we'll come back to. So things that make kids more vulnerable, there are the physiological factors like the 801 baby. Do you all know what the 801 baby is? The 801 baby is the sweetest kid in the world if you get them to sleep by 8 o'clock. But if you're off by a minute, they turn into a monster at 801. My daughter, youngest, was an 801 baby. Sweetest thing, still the sweetest thing walking on the face of the earth. But if she didn't get to sleep by 801, she would turn into Dracula. She actually bit me when I didn't get her to bed on time. Then she toddled off to her room as a toddler. Did a breath holding thing, which, just by crying, she wasn't a breath holder. Fell to the floor, turned blue. I'm on the phone with the hospital because I have a baby turning blue. And the older one says, how come you always pay more attention to her than to me? While I'm on the phone with the hospital. But they're both alive and well, and the younger one is now a special education teacher. So she deals with kids who say no when she says yes, and vice versa. Just important things that we do keep in mind about taking into account whether kids are hungry, taking into account, like this is a particularly bad time of year for people who are prone to allergies. So we do want to cut kids a little bit more slack when we know that they're vulnerable. I have to have a certain standard of behavior here as a professional, no matter what's going on in my life. But I'm an adult and a professional, and I sign on to that. But kids can't necessarily overcome their physiological variables. So we do need to cut a little bit of slack. And while I will argue for consistent parenting, I'll argue for it with an asterisk, which is that when something has gone awry and you need to cut some slack, forgive yourself and forgive your kids. There'll be plenty of other learning opportunities that will come back around on a very regular basis. There'll be many drop-offs. There'll be many of every example of the things you guys mentioned. Psychological stress, certainly we want to take into account the factors that we're going through. Unanticipated change is tough for kids. The younger they are, the more it throws them off. Even anticipated change can be difficult. So your kids who, at 2, may grow up to be a little bit on the more anxious side might be more thrown off by even anticipated changes and seeking kind of reassurance questions. How do I know you're going to pick me up? And that kind of thing. But unanticipated changes throw kids off, and we'll come back to why that is in just a minute. And the bulk of what we need to talk about is about parenting styles and parenting-child interactions, because that's what will broker whether your kids will do a reasonably good job learning how to say yes when you say yes, even though their first reaction is no. So the question is, why can't we simply talk to toddlers about it? Well, what developmental psychologists have done a lot of research on is the difference between concrete thinking and abstract reasoning. Little kids are very concrete. They can't hold ideas as an independent thing of sort of looking at an idea and evaluating it and then using it to conform their behavior, especially when they're aroused. So they think concretely, not abstractly. Kids are terrible reporters about why they do what they do and don't do what they don't do. You can ask them reasons, but I don't know, they often don't provide me very valuable information. And there is a risk of over-talking. One of the psychiatrists came up to me before we started this morning and he said, so what you got to do is just keep talking to your kids. I said, not really, because there's a point of over-talking to your kids. So you want to be aware of what their developmental level is and whether they can really meaningfully participate. And when dysregulated, all of us are not open to information. It's not a terribly good time to hear new information. When we as adults go to medical doctors and are getting information about a new diagnosis, we remember, it turns out, about 50% of the details of what our doctors tell us. It's not because we're unmotivated, it's not because we're not smart, it's because we're stressed out in the moment about what they're telling us. Now imagine if you're not only anxious, but you're actually angry. You just tend not to listen very well, not hear very well. So at a certain point, to quote another psychologist who talks about this, I'm forgetting the author's last name, Tony somebody. He says, say what you got to say, do what you got to do, and leave. I think it's in a book called Get Out of My Life, but first can you drive me and Cheryl to the mall? which is, he has a series of really cute titles. That one I think is for latency age kids. So when we're upset, we're not very open to new information. Please.
I just want to go back to your other point. Sometimes there's too much talking. Can you give us an indication of when that might be? And
Well, first of all, we'll say as a caveat that where health and safety is concerned, you just do what you got to do. So there's really no time for talking with that. If you're reflecting on, if you're in the moment with a child or reflecting on the way you handled some situation, what you want to be asking yourself is, was all that talking actually preventing the kid from getting around to doing what it was I wanted them to do? In which case your talking is reinforcing their dawdling. So in a clinical scenario, when we coach parents who are doing limit setting, we tell them after you've given the explanation, after you've given the instruction, not to get into debating or explaining at all. Just focus on the compliance. We also tell them in advance of that, give the explanation beforehand, because when we get the explanation beforehand, we're more inclined to cooperate. But if you're talking to the kids in between the time you told them to do something, and then you get into debate, it's as if you're saying to them, yeah, you know what, I really would like your approval about this instruction. Let's see if I can get you to agree that it's a good thing. If you're giving an instruction, then you want to follow through. So the question that I would be asking or looking at is, was the talking actually supporting dawdling and not getting around to doing it? Can't overestimate rather, the importance of language. So toddlers are exploding in their language acquisition. If you look at developmental charts, if you go to childmind.org or some of the other websites that have information about developmental milestones, language explodes exponentially. It's a beautiful thing. But to the extent that you don't have language, you can't use it to moderate emotional reactions to things. So if you don't have language to moderate, then you're really left with very raw emotions. So when your kids are just like falling apart, and I mean like literally falling apart, like just falling down, they don't have another tool that they can use at that moment. You or I do. Last week I was in a meeting, somebody did something I didn't like and I sulked. And somebody came up to me afterwards and said, I noticed you were sulking. I could have had more mature responses to it. But the younger you are, the less able you are to muster and call up those other resources when you're upset. So language is a developing tool that helps us moderate our emotions. And it starts with adults modeling emotional talk. So we do encourage you to talk about your feelings going through things. When you're upset, giving words to it, so kids learn to attach words to feelings, and those words become internalized, but only through modeling. You get all kinds of modeling. So if you model cursing when somebody upsets you, you should expect your kids to curse when somebody upsets them. So I remember walking on the Boston Commons with my wife and then now 28-year-old who was probably about 3 at the time. And a car comes and cuts us off on the corner. She was in the stroller, I think, or on my shoulders. And I can't repeat exactly what she said because I don't want these curses on the internet. Let's see how I can say this. She said, as the car came around, she said, JC, and then a body part followed by the word hole. And I looked at my wife and I said, that is not me. That is you, girl. So whatever you model, you should expect that to be modeled. Hopefully you're modeling more coping than poor coping. So I was thinking about any of the number of toddler refusal things that happen. You want them to eat and they're not eating. And this is assuming that you're not setting your kid up for some kind of neurotic eating disorder, anorexia or other thing. But this is a very common kind of thing. And we could have done tying your shoes, we could have done toothbrushing or whatever. But where parenting comes in is so critical, and it's why you're here, so we can talk about that. So very well-known psychologist named Gerald Pattison, who's been in Oregon for decades, did the most important job for us as a field of talking about a coercive cycle. So it starts with child being told to do something like brushing their teeth, and the kid dawdles or refuses. Maybe they're in the middle of something else. Maybe they don't like brushing their teeth. I recently finished treating a 5-year-old who I will say was in the top 10 most aggressive, defiant kids I've ever treated. I'm 58. I've been doing this a while. I've treated a lot of defiant, aggressive kids. You'll have to take that on faith. And he was up there. He was up there. And I love him to death, as did his parents. And literally drove 4.5 hours one way every week to get treatment here because they had already not responded well to other treatments. And we do a particular kind of parent training here that I'll talk about in a few minutes. But he had already had thousands of dollars of dental work because he had refused to brush his teeth for all these years. So that's sort of worst case scenario. Okay, but it happens to somebody. So, child is given a prompt by the parent, they refuse or they dawdle, and the parent then starts escalating their tone. There's something, if we could hook you up to monitors, your blood pressure would rise, you'd get a little bit of a sweat response. It may not be discernible to you, but it is discernible to your child. I have the privilege of doing a lot of treatment from behind a one-way mirror, and I get to watch kids watching their parents, and they pick up on the most subtle changes in your behavior. So there's some change in your tone. When you say it the second time, it's not a voice print of the first time. Now, when we coach parents, we say, pretend you're reading a recipe. So instead of saying, it is time to brush your teeth, we're saying 2 tablespoons of sugar. It's time to brush your teeth. And we're keeping that recipe tone. But the cycle is that the kid says, oh really? I'll see your tone and raise your refusal and a whine, and I'm going to start walking away. And it starts escalating. The parent says, oh really? I'll see your tone and your refusal and your walk away with a bulging carotid artery and a increasing anger level and, the whole bit. But it's the parent's anger at a certain level that then motivates the child to comply. So it's as if they're saying, I don't really need to take action until I've gotten you to a certain level because you intermittently reinforce me by going up a little bit and then just sort of giving up on it. So your inconsistency is reinforcing me for my response, and I know I really don't need to take you seriously until you escalate to the bulging carotid. And then what happens is the kid, you get reinforced. This is the kicker. You get reinforced for escalating. You get punished for not escalating because your not escalating didn't result in the outcome you wanted. And you get reinforced for escalating. This is very seductive. And so this is the cycle that's called a coercive cycle that we need to be aware of and try to work against. If you did a literature search and said, what do we know about parenting? So the Baumrins, as far back as the 70s, a lot of really key work that has stood the test of time was done in the 70s. And the Baumrins identified 3 parenting styles and outcomes associated with them. You see 4 here because somebody added an important one later on. But basically they talked about authoritative parenting, which is associated far and away with the best mental health outcomes. Authoritarian parenting, which is overly strict, overly harsh, without the warmth and without a lot of the positive verbal engagement, which gets the job done in the short run, but doesn't get the job done in the long run. And permissive parenting, or laissez-faire parenting, which was more popular in the 60s, but as people learned the hard way, was associated with kids who became grown-ups who weren't very self-regulated themselves. So this trichotomy, if you will, of authoritative, authoritarian, and permissive parenting, laissez-faire, has stood the test of time. Neglectful parenting was different and added in to the understanding that if you just absent yourself, it's not really a variation on laissez-faire, it's just absenting yourself. So we do know some really, really important things. We know the parenting practices are definitely associated with good mental health outcomes when they are authoritative. We know that inconsistent parenting, while it's hard to be 100% consistent, I think of it as sort of an asymptote that we shoot for. It's a line that we try to achieve to the extent humanly possible, but we accept that we're human. We certainly have evidence that physical discipline is unnecessary. It may be common, it may be popular, it may still be the rule rather than the exception in terms of what people do. And it may be true that 20-something states still allow on the books corporal punishment in school, even though many states don't use that even though it's allowed. But we have a ways to go, we, those who advocate for kids and their mental health, to remind people that you can get the same positive outcomes without resorting to something that doesn't make you feel good. When we interview parents, and granted, we interview parents who walk in our front door. So if there are parents out there who actually feel good about spanking and physical discipline, I don't get to meet them very often. But most people resort to it and then don't feel good about it. And so we work to develop ways around it. Lower warmth as opposed to higher warmth is a critical factor. And again, authoritative versus authoritarian or laissez-faire. So as you're thinking about when do I need to worry about my kids saying yes when I say no or saying no when I say yes, we look at the frequency, the duration, and whether or not there's actually impairment. So if I hear from a parent or a caregiver of a toddler, I do expect the kids to be defiant sometimes. It's part of separating me from you. It's part of finding out just how strong my muscles are. And I want to give you as many opportunities as the toddler to exercise that independence as is possible. So it is good advice, even though it sounds very kind of cookbooky or very pop, to give kids as many choices as possible, when in fact there are choices. So we who do parent training for kids who have real behavior problems, tell parents, give indirect commands, give opportunities that give the kids choice as much as possible. Therefore, when you actually don't give them a choice, it's more powerful and stands out. So when the mom said yesterday, do you want to wear tights or leggings? And I had to ask her to remind me what the difference was. I have 2 girls, but it's been a long time. She actually didn't care which one the kids chose. When she said to her son, do you want twins, she said, do you want to put your underwear on your bed or on your sister's bed? The 2 beds are side by side. She didn't really care. But when it came time to please wipe your nose because the kid all of a sudden had a lot of stuff coming out of it, that's different. That's giving a direct instruction. So we do want to differentiate that, but encourage you to use indirect commands whenever possible, because it retains and supports them in making choices, but also preserves your right to assert yourself when you need to. So we look at the frequency and duration of how often it's happening to help you decide, is this a problem or not? Yes. So authoritative is that you're not afraid to assert yourself, that you set firm, clear limits, that you follow through on those limits, and that there's a high degree of positive regard for the child and a high degree of support of positive behavior. So it's not, and then distilled from that, or as an extension of that, when you're telling your child to do something that they don't want to do, or you're telling them not to do something that they want to do, and they go along with that, you acknowledge it as a difficult task for them, rather than the authoritarian parent who expects it to be done simply because I said so, and doesn't acknowledge that, in fact, the kid is giving in to something that's hard for them. They really did want to keep watching TV. They really did not want to turn off the iPad. They really did want to keep playing with their fire truck. They really didn't want to put on a dress today. That was one of the things that came up yesterday. Mom said, please put this dress on, because she was in a home visit where we're practicing using these skills, practicing asserting herself. When the girl said, I don't want to wear a dress, I don't want to wear a dress, I want to wear what my brother's wearing, she just ignored that and said, if you don't put on the dress, you're going to have to sit on the timeout chair. That's a protocol we follow, where she was being authoritative. She was staying calm, she was staying positive, and as I dictated my progress note on the way in this morning, hands-free, I made note to include in my progress note that Mom was doing a super job giving a high rate of praise for compliance and more generally. So the authoritative parent doesn't feel weak in providing a lot of positive reinforcement to children. An interesting debate in child development, which I didn't include in the talk, but we have a minute to talk about, is the role of praise. So there's an argument led by somebody named Alfie Kohn, K-O-H-N, who talks about the downsides of praise. I don't think there's a lot of data to support that. And even if you do like philosophically what he says, which is that you can take away the internal motivation from kids if too much of your praise is about pleasing me, you can still do it about praising them and not necessarily relating it to you. So I like how you did a good job putting it on. I like how even though you wanted to keep playing, you came to the table. So the authoritative parent is firm, consistent, with a very high positive regard, versus authoritarian parent who says the same thing more strictly, more automatically, and without enough regard for the fact that this is a developmental task for the child. We help kids do all kinds of things. We help them learn to wipe themselves. We help them learn to walk pretty much just by moving things out of the way. We help them learn to read. We help them learn to write. And we accept that with all of those developmental tasks, it's going to be some trial and error along the way. I think it's a little bit of a reframe, a little bit of a shift in our thinking to think about kids saying no to us as a necessary developmental task. The more you can remember that, the less angrily you'll respond to their saying no when you say yes, or the other one where da-da-da-da-da. Does that help?
Yes.
Okay. That's a really important distinction. There will be days you're going to feel stressed out. There'll be times you're wondering if you actually have more of a problem on your hand than you realized. And I wanted to give some guidance and some guidelines as to what to do. There's a lot of support out there. Hopefully you feel like you have people you can turn to, from peers or support groups. The internet community is an interesting place to get support. I think you have to be a really, really good consumer and know that the internet pulls a lot of different kinds of people. So be mindful that when advice is being given, you want to vet it in some way, because all of the advice that's out there doesn't deserve equal weight. I think to the extent that you go to .org and .edu sites over .com sites, you're going to get more professional advice that can be substantiated more. I'm very clear when I do therapy. I'm very clear when I give presentations what advice I can support with data versus really what's sort of a philosophical style thing. So just try and be good consumers. But getting support and finding out what other people go through is important. I think taking stock of what you've done that's worked well and trying to repeat that makes good sense on the face of it. I can't emphasize enough how consistency is really, really key. You might think to yourself, well, I do pretty good. I mean, 8 times out of 10 I handle it and follow through. Only 2 times out of 10 I don't. But I'm a psychologist specializing in behavior, and I can tell you that the 2 out of 10 times that you don't is something called intermittent reinforcement, and it's a very powerful way to keep misbehavior going. I wish I could tell you that it was otherwise, but those 2 out of 10 times that you give in to something or don't follow through reinforce for the child that they should buy another lottery ticket. We don't buy lottery tickets thinking we're going to win every time. We only expect to win intermittently. I actually don't buy lottery tickets, but I'm told that's what people do. But we don't expect to win every time. But with child behavior, to the extent that you're inconsistent, you will pay the price, because they will want to maximize their gains, not because they're evil, they're just maximizing their gains, no different than we would do. Positive attending is so key, because every time you have one of these interactions that feels like it's chipping away at the parent-child relationship, to some extent you can think of it like a bank account that's like a withdrawal when it feels like it's chipping away. So we do encourage several minutes a day of positive interactions, no matter how good or bad the day is. The analogy that I use is that, God forbid your child had diabetes, you would never for a minute think to withhold their insulin or their blood testing just because you were angry at them that day. So positive parenting time ends up being really, really key, because relationships need to heal. Kids actually move on better than we do. Can't tell you how many times, I mean, you know this. You see kids just move on to the next thing, and your guts are being swirled and twirled in lots of different ways. Active ignoring gets an asterisk, because if you're going to ignore behavior, there's a couple of things you want to know. So if you're going to ignore the tantrum, if you're going to ignore the defiance, if you're going to ignore it, you want to keep ignoring it until it goes away. Because if you ignore it only until it really bothers you, that's actually the worst strategy. If you can't ignore it, then pay attention to it early in the sequence, not late in the sequence. Again, I have the luxury of coaching parents and caregivers from behind a one-way mirror. So I remember a time with a boy recently where he was screaming for what the mom had put on top of the cabinet, which is about 6 feet high in our playroom. And she just kept ignoring until he came back to the table to play with her. But if I wasn't coaching her with a bug in the ear, with an earpiece saying, great ignoring, just keep playing with the toys, actually told it to sell the toy to me like you're an ad on TV. Wow, this thing moves in all kinds of neat directions. You know, ads are meant to pull us in. And the kid eventually came over, and that's where the asterisk comes in, that you ignore until the behavior goes away, and, really key until you're paying attention to something positive. If you're only ignoring until the behavior goes away, but you're not then reapplying your positive attention to some other behavior, you've just lost a really good opportunity. I don't like, for example, taking toys away from older kids when they misused it without giving them another opportunity to be successful with the same toy. Otherwise, there's no positive learning in the process. If, in fact, it's a toy you don't want to play with, that's a different issue, like a knife or something.
So the challenge with ignoring that I find is you're trying to ignore something till it ends. Are you distracting the child by saying, oh wow, look at this toy, and is that also giving inadvertently some kind of reinforcing, or you're trying to separate yourself?
I do know what you mean. I'm going to restate the question. It's a very important one. If you're ignoring a child who's, let's say, Mommy, I want a cookie, 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 Mommy, I want a cookie. And if you're ignoring it, but if you're ignoring by distracting and saying, wow, this Lego is so cool. Oh, I love the way the blue one fits on the red one. I'm making a house. Are you technically ignoring? So it's an interesting technical question. Technically, you're not really ignoring, because if you're ignoring, it would be no verbal contact, no visual contact, no physical contact. But it's a nice compromise between ignoring and providing them a roadmap to get involved with a more positive behavior. But it is an interesting question. There's the time when we also do that, but it becomes even more interesting, is if your child is in a timeout. So they're sitting in the timeout chair, and you're engaging in play. Are you helping or hurting the process? We think if you're just interesting rather than overly exciting, that you're, again, providing kind of a roadmap and incentive to want to come back into play. Again, I love our playroom because while the parent is ignoring and facing our one-way mirror and the child is on the side, we can say to the parent, he's kind of ducking around to see what you're doing, so it's just the right level of stimulation. But it's an interesting technical question.
Yeah, well, that's a challenge with my son, like, we're not giving him a chance to actually learn to regulate himself because we're constantly ignoring and distracting.
When we treat things like obsessive compulsive disorder, this is not a segue into kids who have difficulty with this normal developmental stage are not at risk for OCD. But what we teach people to do is to have an urge that just habituates on its own. So if you expose the hand washer, child or adult, to dirt and get them to choose not to wash their hands until the urge goes away, the urge does go away. And that's self-regulation, even though we're not talking to death. So we don't teach patients with OCD to use distraction. In fact, we teach them to focus on the urge and find out it doesn't kill you. But I really want to make sure I'm emphasizing children saying yes when you say no, and vice versa, as a normal developmental stage, as a critical developmental stage.
I'm wondering about kind of time-based ignoring to build up patience. So like one example is our toddler is 17 months old, and the second she sees the refrigerator and she's seeing how she wants to eat pet food and stuff and maybe carrot. So we say, patience, give it people, but then do actually receive feedback. And I'm wondering if that's what you were talking about in terms of you're actually, she sees that as the reward for
It's an interesting example, I think, and I'll restate what I think you said you're doing, and I think you're doing the right thing. So a 17-month-old sees the fridge open, and just like Pavlov's dogs, they start salivating to the thought of the fridge opening. Pavlov's dogs salivated to the white lab coat that the experimenter wore, even though you don't eat white lab coats, right? But they're associated with food and food powder. So 17-month-old sees the fridge open. So the question is, if you attend to their behavior while they're waiting, are you helping or hindering? And I think you're helping because you're giving them language to process while they're waiting. So they're getting to experience the delay, but in a graduated way that's not so aversive. So I never said, and I don't want to say, that kids need to experience it as aversive. They just need to experience it as somewhat uncomfortable, often enough that the discomfort doesn't become a cue for something intolerable. It's such a key life skill for us to be able to experience mild discomfort and not have it be a false alarm that to be equated with when we're really in danger or discomfort.
What do you do if your spouse is playing and then it keeps escalating to a point where he disassociates himself with the play because now he's upset, he's not listening to him or respecting him or and then you always ask to get involved and fix the situation. Because I don't want to be the person who, because I want the kids to look at him as their grown-up. But yet I'm always getting into when it's kind of falling apart.
So the question is, if a spouse is trying to do things to help development, it falls apart, they withdraw, and the child then looks to you as the parent to make it all better. You can come in and rescue, but you are correct in what by implication.
Because it happens on a daily basis and all the time.
So if a family was consulting with me and presenting that, what I would want to make sure is that there's opportunities for corrected experiences. You can't just talk about behavior change, you actually have to practice it. So one needs a roadmap. So it may be that this aspect of parenting comes more intuitively to you than to your partner. So I think just legitimately having some discussion about how to hang in there, what to follow through with, going online tomorrow and having sending the link to your husband to watch this video will help in terms of not absenting once there's a little bit of conflict. But it's a process of corrected experiences. And maybe part of it is just reminding this person that this is a necessary part of development, not aberrant development.
I just want his relationship to be in a good place.
And the way we do that is we teach parents how to first play and build the most positive attachment before we add on limit setting. So the first thing you want to support is brief periods of positive play, and then adding on hanging in there with setting limits. And it may take a lot of coaching and going home and just talking about this experience here. And just as a reminder, it's a cumulative, parenting is a cumulative experience. But it takes a lot of support to get somebody to hang in there with a kid who's behaving in ways that some of those pictures are showing. So just a brief word about when things get to the next level. There are different forms of parent training, and among the things that psychologists do really well, that we have a lot of evidence for, is parent training for oppositional behavior. Again, I'm not equating the normal developmental task and process of kids saying no or yes with needing clinical intervention, but it's good to know that when it gets to a certain level, there are super effective parent training programs. The one that we do a lot of here is called parent-child interaction therapy, and if you were to Google what's evidence-based treatment for oppositional behavior in young kids, this would be one of about 3 or 4 treatments that would come up on your search. And literally, this is a one-way mirror. We set up a playroom, and we coach parents live, and it's really a great process to go through and to be part of. And the gains in the research on this hold up really, really nicely. One avenue for support for you is childmind.org. Whenever I have questions, I just often go to our website first and then kind of go from there. Today happens to be the kickoff day for Speak Up for Kids, and there are tons of really interesting partners from around the globe that we've been working with to develop some information and resources. I'm looking forward to going through some of those videos and resources myself. So I do have time for a few questions, and I thank you for coming out on this lovely Wednesday morning. Yes?
I have one. Okay, it's actually her son, one of her children.
Who I assume you happen to know.
Yes, she's my niece. She has he's going to be 7-year-old boy who's on the autism spectrum, and then she has a 4-year-old who, she shows, she'll warm up, but who, since he was very little, was very physically aggressive, to the point of beating up his older brother and hitting. Has he still hitting you or something? It happens sometimes. And so I was just very concerned earlier on. He's still doing it, not to the extent. But he's a very physically aggressive boy, and he's also confrontational with her in particular. So, I mean, is that something that would benefit from this ECIT situation?
Unequivocally, yes. So aggression, when it's to the point that it's ongoing and causing an impairment in relationships, is definitely worth getting treatment for. And PCIT is among the treatments that are available. But it's bad for kids, it's bad for parents, and it's bad for parent-child relations to have anybody hurting anybody and not be able to control aggressive impulses and urges. Again, it's a form of, some arousal happens that we have a false alarm and we say it's intolerable, I have to make it go away. And life is full of things that we have to learn don't go our way. So we definitely, the earlier we intervene with kids, the better. Turns out that parents often wait about 2 years, a little more than 2 years from the time they know that there's really a problem to when they get help. And we often say around here, there's nothing else that we would let fester for 2 years. We wouldn't let a rash fester for 2 years. We wouldn't let GI disturbance fester for 2 years. It's something about our culture, and not only our culture, I think in many, where we let these behavioral and emotional things stew and they grow. They're like tumors. They don't tend to get better on their own often enough. So I don't like the odds ratio of just waiting. Yes?
Could you talk a little bit about when your child has said when you want to talk to you want to express or help name the emotion? Like, I guess I get stuck a little bit because I don't want to say, oh, I don't want to tell them how they're feeling. I want them, I'm happy to say, oh, you're upset. That obviously means a lot of different things. When is it okay to say, oh, you seem really angry, or oh, you seem really sad, or, you know what I mean?
I do. I think it's okay to be, the question is how to help them label feelings.
Right, yeah.
2 aspects I want to address. One is just to go back to the timing issue, that you want to help after they've done whatever they needed to do. And then you're kind of doing a post hoc, if you will, after the fact labeling of it. But you don't want that discussion to be the reason that they're not doing whatever they needed to do. After that, you take your best shot at labeling feelings. When it comes to nuances of frustrated versus angry versus upset, they probably overlap. We can use those words somewhat interchangeably. I think it's just getting in the habit of feelings have labels, and labels help us get some distance from it, especially as we get older. So I wouldn't be afraid of mislabeling it. They can always correct you. Time for one more question.
I have a 17-month-old who, for the most part, is extremely happy, but the time he gets going to put it away, he'll cry. So I get him off. The head rush from Jack sometimes get a little, but he'll actually put his phone away. And at what point
So if being upset about something results in escalating to the point of a headbutt, and you said that you know you,
Well, he's very aware of what he's doing. So if you try to distract him by saying, "Oh, come on over here," or do something else, he's very determined to sort of do what he wants to do. You need to just distract the child.
so let me differentiate being willful from being manipulative. Being willful and wanting to follow through on what I want to do is not necessarily just oppositional and I want to just manipulate you into not getting your way. It could be just that I really want my way. So I would encourage you not to overinterpret the behavior as manipulative, but it's okay to see it as strong and willful.
At what point do you see it as a problem? I mean, as it goes on for 2.5.
When you say it, what's the, which behavior?
That type of demonstration of
So if you want to know whether behavior is being done for attention, here's a good rule of thumb. Ask yourself, would the behavior be happening if I wasn't there? So nose picking is not usually done for attention. Kids pick their nose because it feels good. Playing with their genitals, it's usually not being done for attention. We do it because it feels good. But headbutting happens only in the context of a relationship. Kids rarely will headbutt people or things without it having an attention function. So I would say look at ways to pull attention away from behavior you don't like, reapportion that same attention to behaviors you do like, and know fairly confidently, unless this child is severely autistic, which he's not, that probably that behavior will go away. So a behavior that wasn't meant to get attention can end up being reinforced by attention. So when my daughter did that 801 bite and I just put it down and I said no, that was all the attention I wanted to give to it. It's not the time to get into a discussion, which ends up reinforcing with a lot of attention.
What did you do after you put it down? Walked away.
She walked away. That's when she fell and turned blue. But I would have been content just to withdraw my very powerful attention, then looking for an opportunity to pay attention to something positive. So being able to say to kids, I love how you calmed yourself down, now you have a safe body, that's very reinforcing and helps them maintain that behavior. Even if, parenthetically, they initially say, "Rrr," to that compliment, consistent use of that kind of label praise will be helpful. So let me end on that note. I see we're out of time. And just a reminder that next Wednesday is the third in a series of 4. My good colleague Rachel Bussman will be presenting a topic called Please Don't Leave Me. She specializes in separation anxiety and other kinds of anxiety, and I'm sure it'll be a terrific workshop. And the 4th workshop in the series on the 15th is on the topic of speech and language with my other good colleague Rachel Cortese. So I hope you'll be here for those, and thank you for joining us this morning.